Most people assume the healthcare system will always be there when they need it, but history shows that's not always true. When systems fail, the impact isn't immediate chaos, it's a slow breakdown that changes how people think, decide, and survive. At first, nothing seems drastically different. Hospitals still exist. Pharmacies still open their doors. But something starts to shift beneath the surface. Supplies become inconsistent. Waiting times stretch. Simple treatments become harder to access, and most people don't recognize the change until it directly affects them. You go to get something routine, maybe medication, maybe a basic check, and suddenly it's unavailable. Not permanently. Just, not today. You're told to come back later. So you do, and then it happens again. This is where frustration begins to build. Not because the system is gone, but because it's no longer reliable. People start adjusting. At first, in small ways. They stock a little extra. They delay non-urgent visits. They begin to question what actually requires professional care, and what doesn't. But this creates a new kind of problem, because most people were never taught how to make those decisions on their own. So they rely on guesswork, and guesswork under pressure rarely leads to confidence. It leads to hesitation. You start second-guessing symptoms. You wait longer than you should. Or you act too early without enough information. Either way, the outcome feels uncertain. This is where the real shift happens, not in the system, but in the individual. The visible problem is lack of access. But underneath that, there's a deeper layer, lack of structure. For years, the system handled the structure for you. It told you when to act, who to trust, what to take, and how serious something might be. When that disappears, you're not just dealing with fewer resources, you're dealing with a missing framework. It's like being dropped into the middle of a complex situation without a map. At first, people look for replacements. Online advice, home remedies, anything that feels like guidance. Some of it works, some of it doesn't, but without a way to evaluate those options, everything starts to feel equally uncertain, and that's where many people get stuck. Because the real issue isn't just that healthcare systems stop working, it's that most individuals were never prepared to operate without them. Think about it. If something small happens, a cut, a fever, mild pain, you don't just need tools. You need to understand what matters and what doesn't. You need to recognize patterns. You need to know when something is escalating, and when it's stable. But that kind of awareness isn't built in the moment. It comes from understanding structure before you need it, and this is the turning point. The real issue isn't the absence of the system. It's the absence of independent decision-making. Once you see that, everything changes, because preparation stops being about stockpiling random supplies and starts becoming about clarity. Clarity about what problems are most likely, clarity about how those problems evolve, clarity about what actions actually make a difference. This doesn't mean replacing doctors. It doesn't mean handling everything alone. It means reducing dependence on immediate access. By increasing your ability to think through situations. When people begin to shift their focus this way, something interesting happens. They become calmer, not because problems disappear but because uncertainty decreases. They stop reacting impulsively. They start observing more carefully, and even in limited conditions, that changes outcomes, because in many cases, the difference isn't the availability of advanced care. It's the ability to act early, act appropriately, and avoid making things worse. So when healthcare systems begin to fail, the question isn't just, what do you do? It's, how do you think? Because the people who navigate those situations best aren't the ones with the most resources. They're the ones with the clearest understanding. If you want to go deeper into this, there's a structured breakdown in the description that walks through how to think about these situations step by step. And if this kind of perspective helps you see things more clearly, consider subscribing. Calm thinking always outperforms panic.